Hello, everyone. This is Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and welcome to Plastic Surgery TNA. That's talk and advice for returning viewers and listeners. Thank you so much. I really appreciate your support. If you're new to this channel, I am a board certified plastic surgeon here in Metro Atlanta, and I like to spread truth and transformation. I've been in practice for 20 years. So stick around. You'll get the real deal on plastic surgery. If you like this channel, do me a favor. Subscribe. It really helps me try to grow the channel. I'm trying to line up about 4 or 5 guests. I know I've been saying that for a while, but I've got them in the pipeline. So that'll help me accelerate that process and do things greater and beyond that as well. Again, just like and subscribe if you like the content of this podcast. With that being said, I always find it interesting when I engage with my old clients or new clients, and I engage with a new client outside of the area. Uh, just she just wanted to have a conversation, so we had about a 15 or 20 minute conversation. And one of the focuses on the conversation was breast implant illness. And I don't know if many of you have heard about that. It's certainly been around for a little while now. I wouldn't say it's new, but it's not something that's been around for 40 or 50 years. And she thought, because she did listen to the podcast, and I really thank her for that, that it would be an interesting topic. And I hadn't really thought about it, to be very honest with you. And I agreed with her. I said, I'm gonna plug that in the system and try to get that done. So what I really want to do, and it really marries really well because this is breast cancer awareness month. So I think this really ties in fairly nicely. Breast implants, whether they're saltwater or silicone, have been widely studied, widely maligned, and rightfully so to some degree because of all the controversy that these devices have caused with women's health. And I'm all for women, looking, feeling their best, confident, but we want to do that safely. And so the FDA has really been really staunch about making sure that these devices are developed with the utmost quality care, that these devices, once they're placed, are followed up, exhaustively so that if there are any outlying symptoms, problems, that we can know about this. And so during this whole process from the 80s until now, that's been done. And what's been discovered are two new entities, very rare, but still new. And you need to be aware of that. So I'm going to bring that to you. If you visited with a plastic surgeon or you follow plastic surgeons on social media, I'm sure they've talked about this as well. There are two entities that I want to talk about with this podcast. Number one is breast implant associated anaplastic large cell lymphoma. That's $1 million word. This says that, a certain type of implant can cause a really, really rare cancer, a lymphoma. So that's the first thing I want to spend some time with. And the second thing is based on my discussion with my new client is breast implant illness. And that's defined as kind of these symptoms, almost like rheumatologic symptoms that can be and have been somewhat associated with breast implants. So, with that being said, let's talk about breast implant illness. So, breast implant illness basically is a rare lymphoma. It's a really, really rare lymphoma. And I'm going to give you the information that you need to know. So, what is a woman's risk? Because you're thinking about getting implants, or heck, you've already gotten implants, whether it's a cosmetic implantation for enhancement or whether it's a reconstructive uh, implant placement. This can be, and unlikely now, can be a problem. So, what's your risk? The risk of this particular issue where you've gotten lymphoma or a cancer around the implant really is about one, and it's pretty wide, one in, let's say, 4,000 to one in 30,000. Doesn't really nail it down, but that's what the literature or science shows to date. So, can be 1 in 4,000, could be 1 in 30,000. The important thing is that it's really associated with a very specific type of implant. It's associated with an implant that is a textured implant. So, and let me add to that, it's not only a textured implant, but it's a textured silicone implant. So let's back a second. Let's take a bigger view. You have two types of implants. You have a saline implant, which is salt water, and you have a silicone implant, which is kind of a soft, gummy feel. The implants obviously have a cover or a shell. The shell for saline implants is typically smooth. Rarely, if ever, I've never worked with a textured saline implant, and I've been in this business nearly 20 years. Silicone implants used to, and let me say used to, until this was discovered, come with a covering that was either smooth or textured. And here's an example of that. So the silicone implant on the screen to your left is a smooth implant. And that's what the majority of the implants that are in place now look like. Way back yonder, and I don't really mean way back yonder, last 15 or 20 years at most, textured implants were placed. And you're going, why would a plastic surgeon place a textured implant? Well, based on my understanding, based on my practice, based on the philosophies at the time, there were a couple of reasons. You would take a textured implant and you would put it above the muscle. And this texture wasn't really hard or rough like sandpaper, but it was a finer grit on the top. It would allow your own tissue to kind of grow and attached to the implant surface, almost like Velcro, and it would keep the implant pretty stable. So if you guys have followed me, I've talked about, implant abnormalities like implants being kind of out of position, out to your armpit, kind of down below. A textured implant above the muscle was touted as a really great idea because it velcro the implant to your breast and, for lack of a better term, to the top of your muscle. And so it kept its shape and position. That was a that was really hot. But come to find out that women were presenting back to, maybe their original plastic surgeon or to another plastic surgeon if they've moved or the plastic surgeon retired or, heaven forbid, passed away, or maybe into their primary care physician because they've got a swollen breast or they felt a lump in their arm, and which caused great alarm. When that was found, these patients got back to their plastic surgeon, and it was found through various test x-rays that these women had a fluid around their breast implant. And that fluid, when that fluid was drawn off with a little syringe, found under a microscope to have these cancerous cells. And these cancerous cells are really from the inflammation, the normal reaction of your body to this textured implant that causes that implant to become kind of sticky. But that inflammation, unlike when cut your finger, you cut your finger, inflammation starts the healing process. Once that process is stopped, then there's no more inflammation. But with this implant, it found that the inflammation was ongoing, 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 and ongoing. With that constant stress on those inflammatory cells, and lymphocytes are part of the inflammatory process. Those cells underwent changes to their DNA and became immortal. And that's what cancer cells are. They are immortal. Cells that are not cancerous, our normal cells, have a life cycle. They are born, they live, and they die, and they're replaced. Cancer cells do not. They continue to live where they naturally live, and then once they get tired of that, they start living in places where they shouldn't. They start living in your bone. They start living in your bloodstream. They start living in your lungs. They start living in your armpit or your groin. You get the picture. So, what was found with these particular patients with textured implants above the muscle, that they had this fluid was analyzed, and it had abnormal cells. That fluid could be also in the armpit, or it could be a swollen lump in the armpit, which then that lump was also aspirated, which is the $1 million word, where those cells were studied as well, and they showed the same cancerous lymphocytes. And so a protocol was developed. One, the sirens were sounded, and that anyone who had a textured implant had those removed, or they were strongly recommended by the FDA that these be removed. And implant companies comply, because no one wants to jeopardize the health of our population. And so it was a no-brainer. So there was a mass explantation of textured implants. And so moving forward, if a woman developed swelling and she sought counsel from her plastic surgeon, that plastic surgeon should do a couple of things, an examination, of course, but there's some imaging that should be done, such as like an MRI. So, an MRI, and I have a picture of that, will show the fluid. We have an MRI here on the screen. Let me orient you. This is a breast from the side view. Let's start in the middle and work our way out. In the middle is the implant. The next layer, the white layer, is the fluid, and that's abnormal. That should not be fluid around an implant. And the layer beyond that is the breast and the skin. So this is what a positive fluid collection could look like. Now, you have an implant, let's say it's textured, it has a fluid on an MRI, doesn't mean automatically that this is, you know, anaplastic large cell lymphoma. So it needs to be analyzed, typically under, local anesthetic, maybe even sedation. This fluid, the area numbed up of the breast where a fluid can be drawn off and taken and analyzed under a microscope. Once it's analyzed and it's determined that this is, lymphoma, then we got to move. It is then recommended that obviously you get connected with an oncologist or a cancer doctor. The next step is this only here in this breast, or has this disease, these lymphocytes that are immortal, moved to your armpit, to your chest, to your lungs, etc., etc.? And so visiting with your oncologist will get you the plan to determine if this is something that's outside the confines of the breast. So you end up getting a PET scan, PET CT, and that scan is a full body scan, for lack of a better term. And it lights up much kind of like this white area on an MRI, where you have abnormal cells that probably are most likely cancerous. Again, no one wants this outcome. There are a ton of implants out there. Hopefully, none now that are textured, certainly not in the United States, but there are a ton of implants out there. And this is a really rare disease. Again, 1 in 4,000 to 1 in 30,000. But if it happens to you or it happens to your loved one, it's 100 out of 100. So If you are considering breast implants as part of a cosmetic procedure or as part of a reconstructive procedure, you need to be aware of this potential rare but potential complication. So, as plastic surgeons, we should sit down with our clients who are entertaining having breast implants and make sure that they're aware of this. You should actually get documentation or literature or information in your hand so that you're aware of this. So, what is the treatment? And is this fatal? It can be fatal, especially if it's outside of the breast. Treatment usually, obviously, is directed by oncologists, and I'm not an oncologist. And again, if this is a really subject that you guys want to take a deep dive on, at some point, I'll have an oncologist on. We can talk about all things breast cancer, and that may be a good subject matter to pick up. But nonetheless, we're guided by our oncologists, and the two mainstays, as we know, of treatment currently would be radiation treatment and or chemotherapy. So, again, rare disease, maybe not talked about that much because nobody wants to talk about things that are unpleasant, but you need to so you can be informed. This is the truth in transformation. You may hear all this and go, nah, bruh, I'm not doing that. Fine. You've been well informed. But if you don't know about this, you weren't told about this, then you were done a disservice. Or maybe you were just before that time where this was discovered. Or maybe you had these placed outside of the United States and now you live here. You might want to have this investigated, which leads me to my last point before we pivot and head on to breast implant illness. If you have breast implants, if everything's going swimmingly, fantastic, but you still need to see your plastic surgeon once a year for checks because more than likely you won't have this, but you could have abnormal positions of the implant, lateral displacement, you can have bottoming out of an implant, you can have a rupture of an implant, and these things can be detected by an expert like a plastic surgeon. Typically with physical exam, but it may require some additional studies such as MRI or any ultrasound or any type of other x-ray that would give us pertinent or relative or pertinent information that would be helpful. So that's BIA-AC, excuse me, BIA-ALCL, breast implant associated anaplastic large cell lymphoma. Very rare, but you need to know. Now, number two, which prompted this whole podcast, is breast implant illness. Not fatal, but certainly draining and disconcerting to the client or the patient. So breast implant illness. Let's take this step. We're going to talk about that. And again, everything you need to know right here on Plastic Surgery TNA. So, what is breast implant illness? It's kind of a nebulous constellation of symptoms. It's not one thing. It starts with, things like symptoms like brain fog, uh, symptoms like joint pain, muscle pain. Let's put this up. It's a diagram. Uh, dry eyes. Some people will say GI problems, weight problems, or weight change problems. Some people will say anxiety. Some people say Raynaud's phenomenon or syndrome, which is a vascular problem with your hand where your hand turns blue and red depending on the temperature. But it's a constellation of these symptoms that kind of fall into like rheumatoid or rheumatologic issues where you would see a rheumatologist because this is an immune system problem. And typically these patients fall into these have these symptoms and fall into this category and they often just go see their rheumatologist. because they feel terrible. They feel like they got flu, they're fatigued, they got muscle aches, brain fog, all the things I mentioned. And they go see their rheumatologist and they have a full, what we call jokingly, $1 million workup to make sure that they don't have rheumatoid arthritis, make sure they don't have Sjogren's disease, or make sure they don't have psoriatic arthritis, or any myriad of known autoimmune diseases that cause fatigue, changes in your lab work, such as blood counts, uh, markers in your blood that show that you have kind of ongoing inflammation. Again, all the symptoms that I talked about, hair loss, brain fog, so on and so forth. But what happens with this subset of patients, they really don't have strong evidence of known diagnosis or diagnosis of these problems. They don't have the blood test that would point directly to having uh, rheumatoid arthritis or systemic lupus or psoriatic arthritis. So the rheumatologist is left scratching his or her head, and the patient is frustrated. And so over time, I think there's been enough momentum of this subset of patients that just are frustrated with feeling terrible. And there's a small movement that said, "Hey, I went through all these things, and I had no diagnosis, and I read something somewhere that someone had this happen to them and they took their breast implants out and they got better." And this started a movement. And patients who've had this problem where they just have seen doctor after doctor and had test after test after year, who happen to have had a breast augmentation or breast reconstruction for that matter, finally go to a plastic surgeon and say, "Hey, there's this underground diagnosis that I think I may have. I think I have what we call breast implant illness, or my breast implants are making me sick. I've known people who've had this out and had all these tests for these other diseases, which tended to be negative, and had their breast implants out, and now they feel better. Can you take my breast implants out? Will you take my breast implants out?" And this presented a huge, huge quandary for plastic surgeons. I mean, this happened to me. A patient I knew, uh, she came to my office. I'll give you the story. I think the story tells you as much as I can explain it. She came to my office, having had saline breast implants. Now, this can happen with saline smooth, saline, silicone smooth, or silicone texture. It doesn't matter. Breast implant illness can happen with any implant. But she happened to have smooth saline implants. And she came to me and said, "Hey, doc, I've had these implants. You've known me for a while. I've had these implants placed by someone else, which is irrelevant, but that's the story. And, my hair's been falling out. I feel like crap. Joints ache. I don't have energy. I'm just feel bad. And it's making me feel down. It's hurting my relationship with my plus one. It's hurting my relationship with my kids. I just need something done. And I've been doing research and reading because I need to find an answer. And no one has an answer for me. And I've done everything. And the only thing I haven't done is take out my implants." I'm like, "Oh my gosh. Hey, I can take out your implants, but how can I tell if you're better? There's no blood test that I can get this beforehand that says, 'Oh yeah, this blood test points to your implants being a problem.' There's nothing afterwards I can point to for a blood test or X-ray, again, to point to that, yeah, your implants were the problem." So it's really a diagnosis of exclusion and a treatment of a rule out treatment. What I mean by that is you kind of figure out if it worked by doing the surgery, and you figure out if it didn't work by doing the surgery. So it's a risk that these clients slash patients are willing to take because they've been down every road 5 times over and they're sick of it, literally sick of it. And so she convinced me, not at that particular consultation, but over, let's say, a couple of weeks, that Well, I just want them out. It doesn't matter. Hopefully, I feel better. I think I will. If I don't, then I know that's not the answer. And I can understand that. I could follow that line of thinking. I spoke with her rheumatologist. I looked at all her lab work, and none of that showed any problems. So, lo and behold, we take out the implants. She does well from a recovery standpoint, and she goes on. She resurfaces, let's say 6 months to a year later, says, "Hey, doc, I want to come and talk to you about doing the lift. I feel so much better." I mean, it took a minute, but the implants were out and I started to get my energy back. My hair grew back. I stopped having joint pain. I felt better. I just felt better all around, and everybody could see that. And I was able to regain my life. So it's a real thing. Don't be fooled. Younger plastic surgeons, I know you probably know that now, but it's a real thing. Older plastic surgeons, it's a real thing. It's a real thing. I even have to keep telling myself it's a real thing. What you want to do as the plastic surgeon is make sure that everything else has been ruled out, and so that you and the patient can have a intelligent, informational conversation about what we're doing, why we're doing, the potential outcomes, and set expectations. This breast implant illness is due to the same type of inflammation. What's believed is that just a tiny amount of bacteria have gotten on the surface of that implant, most likely at the time the implant was placed, but it could be from some bacteria that traveled down the nipple at some unknown time afterwards. But it gets just enough bacteria around the implant to cause the body to go, "Uh-oh, we got a problem. We got an implant. We know that. We're good with that. But now the implant's got something going on with it, and we need to, try to fix it." And so, bam, inflammation again. But this inflammation never clears the problem, so it never shuts down, and it's just ongoing and ongoing, and it just makes the patient feel terrible. It's just a generalized inflammation, and having generalized inflammation sucks. Just take it from me. I know personally it sucks. So, what you need to do is to take these clients seriously. Clients, patients, women, go see your plastic surgeon yearly. Make sure that you stay on top of this. If there are weird symptoms, and you check out with your rheumatologist and you think that this is, not an issue from that standpoint, and you talk with your plastic surgeon, make sure you have these conversations and make sure you stay on top of these things. There's no age specific uh, person that, excuse me, is likely to get this, young and old. Uh, any type of ethnicity, black, white, in between. It's just the risk factor that you have an implant. And again, it's super rare. I don't have the numbers for you. And I apologize for that, but super rare because there are a ton of women. I mean, a ton of women that have implants. But again, there's a certain small fraction or subset that have this problem. So that's breast implant illness. This is, again, in line with, breast cancer awareness month. I mean, we want to make sure that we keep our women that we care about healthy. Our mothers, our sisters, our neighbors, our friends, our aunts, our daughters. You get the picture, healthy. And that takes everybody. So you may not be a plastic surgeon. Maybe you're a husband. Maybe you're a brother. Maybe you're an uncle. Maybe you're a boyfriend. Maybe you're even a really close neighbor. Excuse me. You know about this. You've heard about this. If you are having dialogue that, yeah, I'm not feeling great, if you have these conversations, then you can encourage that woman that you care about to go see her plastic surgeon or primary care physician or rheumatologist or someone to start the process off so that we can have answers. You can even see me. I might not even be your plastic surgeon, just like the case that I gave you, the real life example. I wasn't her original operating surgeon, but I've taken care of that and some other things for her ongoing. And if you want to do that, it's really simple. All you do is call my office and set up a consultation. 770-466-4700. It's real easy. We have a relaxed, chilled environment. We're not rushing. We're here for you. We want to make sure that you're good when you leave here, that you feel confident that this was a great use of your time and you've got information to make important decisions with. So call the office. I really encourage you to do that. You can email, you can do those other things, but this is so important. I want you just to call. I can give you my email and give you all my social media. But this is not something to treat with arm's distance. If you're struggling with this, or you think you may have an issue with this, or you just want to be checked out and your plastic surgery is no longer in practice, or you moved cross country or whatever, and you're never really established a plastic surgeon, whether it's here, right here in Metro Atlanta, or you're outside of Metro Atlanta and you think you have a connection with me and that we can work well together, you know, reach out, call the office. If you're outside of the area, you can't physically come to the office, we have virtual consultations. We got a process. We'll set you up with that. So, with that being said, I hope you guys have enjoyed this really informational, really important. Not that my other podcasts haven't, but really important topic or topics today. Again, I really appreciate you joining. If you like what you saw, please, 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 I would invite you to subscribe. Subscribe to my podcast. Subscribe to my YouTube page. That's what I really want you to do. But I really like you to listen to my podcast and have other informational videos there as well. And then if you want to see me, just call the office and we'll get you scheduled at the number below. If you have questions and this you're seeing this, as a recording and not live, or it's been a couple days, again, you still can just put something in the reply box, comment box. I often look, I certainly get notifications. I'll try to answer any questions, but the best thing to do is to call the office and schedule an appointment and let's talk. I hope you guys have a wonderful, safe weekend wherever you are in the world. And until next Saturday,